Right. Good evening to all of you according to Sri Lankan time. So, uh, today we are going to discuss on how to study for Mrcgp international exam, the AKT component, that is the part one for first attempt success. It's being the candidate going to sit for this exam. It's very important to know that uh, your the scope and as well as to achieve your goal, the which road is the correct, the road to the achieve the quick, the success, because it will be held in another the few months. So you have to, by this time, you must have started your studies and as well as, but still you are not aware about the clear guidance to know the uh, answer your question paper. So that's why we thought of discussing being the family medicine forum and as well as to share my examiner experience in 12 years to achieve your success easily. During the exam, whenever we were the examiners, they are always asking, to send the single-based answer questions. We are the one making it and sending for them to make the paper to Mrcgp South Asia Board. So with that experience, I thought of sharing this to you all as well, because you all are professional doctors. You want to achieve your goal in order to have a better life. So getting to the success of this exam. So uh, right. You must have your insight before the going to know the even before few months at least. So when you're going to start reading for this exam, know the scope of the blueprint is very crucial, because there is a blueprint for each and every exam where they will, they will uh, the guide, they will, the make it so that they are going to check your knowledge through that, the areas. So that is what we used to call the blueprint, so that the blueprint will be taken from the curriculum. That is the important and the common topics always be questioned. So keep that in mind, because being the primary care physician or the general practitioners, so they are going to check the patient safety and the correct, the evidence-based, the management um, that the patient should recover on it, or patient will be taken out of health risk that the patient has. So because of that, it's accordingly they have made the curriculum. So from the curriculum, they are taking most important, the thinking about the common disease and the red flag disease, that you must know how to identify that, the diagnosis, and how to confirm your clinical diagnosis by investigations, and how to do the management according to the guideline based. The management is the one they are looking for. That knowledge will be checked. So the clinical medicine, because this is the the GPs are clinicians. So 90% of your questions are based on clinical medicine. That is include of all the topics like, the medicine, pediatrics, then gynecology and obstetrician, and as well as the surgery. And the subspecialties like the dermatology and cardiology, respiratory medicine, men's health, like you must um, know your curriculum, which is available at the Mrcgp website. So the other thing is evidence-based practice like critical appraisal. That is very few, the very much few, and sometimes no such a questions as well. Evidence-based practice is that is inclusive of the 90% the clinical medicine. That is, I told you, your clinical diagnosis, your investigation, and your management is based on mostly the evidence-based, the practice through guidelines. That is a nice guideline, and the clinical knowledge summaries are the one they are looking for, because this exam is conducted by Royal College of General Practitioners. So they are based on that. And the evidence-based practice and the critical appraisal, in the sense they are asking about the researchers and how that research is being the appropriate to use at that. It's very much less, they even don't worry about that. And organizational, the professional topics also very much less, right? But you must know about within that uh, professional, they will ask one or two questions in ethics, right? So that is the professional misconduct that they are going to look for. Right. So areas to focus during your study is, that is the prioritize, the areas that with the breadth with depth in the domains that recur most often, right? And as well as, rather than chasing the rare zebras. But anyway, you have to know your focus areas during the study. That is, the chronic disease management is common, very common, like diabetes, high blood pressure, bronchial asthma, and as well as, the therapeutics and prescribing, that is pharmacotherapy. It's very, very important that they are looking for the side effects of this the medicine most of the time, and the guideline based on the treatment for that particular condition, you must know, and the duration and the doses. It's very, very crucial, right? And then coming to the mental health is another very crucial area that you must know, because there are so many mental illnesses, not only you know, not only depression and the schizophrenia, but there are post-traumatic stress disorder and OCD, obsessive compulsive disorder, then the panic attacks, generalized anxiety disorder, and just the anxiety. And so on, like that, there are so many, which body dysmorphia, like that, there are several, so you must know so mental health in depth, right? So that is very, very crucial for you to, because I know most of the doctors who are in when they are going to do the practice, they always, um, forget about the side of mental health. With the we being the qualified, the trained general practitioners, it's a must for us to exclude most of the time the mental illnesses and to diagnose without missing that, in order to give them the proper treatment and the duration of such illnesses to treat, and as well as the pharmacotherapy and the particular type of CBT, that is talking therapies, you must know. And coming further down, the women's and men's health, and as well as the child health, I told you before as well, and emergencies. It's and the red flag diagnosis, red flag disease management, mostly the emergencies, and it's, the related red flags need to be identified. And as because they are asking about the emergencies, So many emergencies, like you must know, because to save the life of the patient, that is, for an example, the myocardial infarction, and as well as, the silent myocardial infarction are there in diabetes and some other elderly people, and as well as, the difficulty in breathing due to the rupture of Bullen side or the worsening of bronchial asthma, and as well as, there's some abdominal problems like acute cholecystitis, and as well as ectopic pregnancy, then appendicitis and rupture of ovarian cyst, like that in the hematemesis and hematuria, the hematemesis and the blood in the urine. Like that, there are some, the sort of emergencies which you must, identify and do the immediate management, and send the patient without any delay to the secondary and the tertiary care units. And the data interpretation and the statistics as well, they are asking, but only one or two questions, statistics mainly, right? So you must know about that as well. Then your reading should be, I told you, according to the NICE and the clinical knowledge summaries. So why NICE? Because it's being according to the Royal College of General Practitioners. The exam is being conducted even though they are doing under the board of the South Asia. That is the mother, the board is, the Royal College of General Practitioners. And you must know that I told you the most common topics. You must know the read and the red flag diseases. The work topic by topic through the blueprint of each, and and the other thing is, and read the CKS summaries first and the full NICE guideline. Not necessary, but it's only where more depth is needed only. But the guideline summaries you can read, and at the BNF for your the pharmacotherapy, and as well as the note of the guideline threshold and the that is the targets in this, numbers in the sense, targets, review intervals and all. These are the common SBA. They are they say the discriminator, right? Because keep a running note of guideline thresholds and as well as numbers. That is the targets. What is your target? What is their target? And review in intervals, right? You have to make it how frequently it's not necessary, but you have to 2-3 times at least review them. So, but the guideline is the base, the guideline is the basis of this, the questions, right? That is what I want to tell you. And simple, the topic to source map is, the chronic disease management and targets, CKS relevant NICE guideline and this thing. And the diagnostic, the use it for the diagnostic threshold and the monitoring intervals, and as well as, the treatment ladders. So prescribing and during the drug safely, that is, according to the BNF, for both adults and children, doses, interactions, contraindications, and the renal and hepatic safety and adjustment you must know, and so on, that you statistics and the critical appraisal, that is not that important. Ethics, they will ask 1 or 2 questions, and the other thing is emergencies and red flags. The CKS is the one you need to look for, right? Okay. So choosing between 2 equally close answers is another important thing, because once a single base question is coming on your paper, there are the other 3, there are 5 answers options, but the others are totally away from your the stem. So, but there are 2 equally the looking in the answers where you have to differentiate it. That is the crucial thing that you must do in single base. So that is reread the exactly what is being asked. That is very important. That is you must know what is the appropriate, uh, what they are going to ask appropriately. So the reread about, that is the last, the stem of the question, right? So you have to reread it, the most appropriate next step, for an example, or most likely diagnosis, or most appropriate investigation. But at once you can see how these two questions are similar. But if you reread that, the what is being asked, like the last, the statement, the most appropriate next step, or like this, the things, then you can easily, the differentiate one from the other. That is another very important thing that you must do, right? Always when you start answering the question, so read the question stem by underlying important of the sentences, and then go to the answer question options. And in the once you go that with that your knowledge, you the concentrate on the stem, you will see two answers like the equal. So you are in a dilemma to check which answer is. Then reread that the final one, the what is the most, the appropriate next step or most likely diagnosis, whatever it is. Then it's easily come again to these two options. Then you can easily select it without wasting your time. And the next important thing is the default to the guideline, and as well as the not general teaching. That is when both options are clinically the defensible. So the one matching, the current, the NICE guideline or the clinical knowledge summaries, first line guidance is the most always the intended answer. That is, the both options, it's easily you can understand. The one matching the current guideline, that is, you must read about the guideline very well and to go ahead with, because guidelines are different. For an example, earlier in early guideline that, for atrial fibrillation, they have added aspirin, but the latest guideline, it is not there. And for another thing is stable angina, the former guideline mentioned that the exercise ECG, but now they say no value of exercise ECG. Straight away patient must be sent for the CT, coronary angiogram. Like that, there are the newest guideline options are the one. So maybe they will use that as well, right? So default to the guideline as well. And other thing is favor safety, urgency, and reversibility. Always they are looking for the patient safety. In that question, you are going to manage as general practitioner. So between two reasonable actions, the safe, more urgent, or more easily reversible option is usually correct in primary care context. So that is reasonable actions, the safer and more urgent or more easily reversible one, the one that answer you must give. Right. And the other thing is absolute, the distrust, always and the never options. That is very crucial. You must, always be suspicious. If the question says always, the answer says always, and, the answer regarding, right, not the stem, always, never, only. And those are the things that you have to be very much suspicious and not to select that, right? That is another easy pathway. So out of all the selection of the choosing between two equally close answers, reread exact what is being asked, and as well as the default, the always and never options, and the favor for the safety, urgently, and reversibility are the very important, the points that you must take care of, and you must practice as well. So a repeatable process for every SBA item is read the stem fully before glancing at the options. That is, don't look at the options, but read the stem very well and without, the in a hurry, but you have to the mark it with the pencil, the underlying the crucial things, and then so that it will go into your brain. No need to repeat reading because time is very crucial in this exam. Most of the candidates are coming down because of the no practice for the timing. So that is very important, and the always read the stem fully before the glancing at options. Better not to see and resist anchoring on the first plausible answer. So better not to check and go to the stem and then go to the answers. Then number two is identify precisely what is being asked. That is the final, the statement. You must know that is what I mentioned before. The diagnosis, next step, investigation or management. Because the two equally answers are being given in between these two. But you can see if you don't read this again, then if you are not clear about this option, so you will be missed. And the number three is formulate your own answer mentally before reading the option list, right? That is, if you know the guidelines, so before reading the list, even if you have any the idea about the answer, that should be there, then you can go ahead to the answers and compare your answer to the 5 options. This is formulate your own answer mentally before reading the option list is, the very much at the beginning it is difficult, but when you get the answer, the question, the training with the proper, the trainer, he will, he or she will, the focus for you to go ahead in that way as well by giving you very close to the evidence based, the answering with, the focusing the important guideline to you for the reading, and it is very important thing. And compare your answer to the 5 option. The closest match is your working answer. That is, I told you the 2 only will be the closely going on. So you have to identify that 2 out of 3 and out of 5 and go ahead with that and compare your answer to the 5 option and finally, right? And then mark your answer. And number 5 is where 2 options remain, apply guideline first, the safety first, and the more specific, the tiebreakers. That is what we mentioned. You have to read about the precisely what is being asked. And the other thing is the mark and move on if still unsure. So better not to waste your time there. So you mark it, then the answer that you have not answered in a star mark or something. Otherwise, you can't identify the question later on, and protect your time budget across all 200 items. I told you the time insufficiency is the very important thing that you will meet up because you all are wasting your time on the difficult questions. No, you have to the mark it and go to the other side. And sometimes from the beginning the questions are difficult, but at the end the questions are easy. So because of that, better not to waste your time on thinking about to select the answers. So train with an experienced Mrcgp examiner, Mrcgp international examiner is very important thing because the doctors who are coming to us, I use my the personal experience to train them to achieve the focus for the exam, because I know the types of questions that they are more fond of, and as well as the types of questions they are asking for us to prepare, and what are the pet topics of them, because common topics are the one they like it, and we know how they are making the questions, because we all together discuss the questions and adjust it in the before the exam. So because of that, it's very important for you to don't just go and select your trainer because of the ads that coming through the websites or coming through the other thing is which are coming through the Facebooks and the social media. Carefully, check the experience of it and what is the experience, and you are really the lucky if you can find such a the experience from the professional trainer, like with the past history of examination. Otherwise, like you just go and sit to the exam and come out and then they are start training. That is not the real insight that they don't have about the exam, right? And the first attempt success roadmap is the 12 to 8 weeks, the out you have to read the blueprint and build your topic to the source reading list, and the begin the guideline based reading. 8 to 4 weeks, the high yield focus areas in depth you have to go through practicing, and 4 to 2 weeks out full the limited mock exams under the supervision and target sessions will with the experience of the examiner or the uh, uh, on the weak areas could be, and the final 2 weeks light focused on the revision and of your the error log and the guideline numbers, and as well as protect sleep because it's very important. Pacing and the exam day logistics are very important. So the important thing is whatever we can, uh, do for the whatever the preparation that you do. So you have to start your practice. So that is the importance. So we thought of giving you some questions for that to show you how to the go through and select it just to the attain with the attain with us to the find out the answers to the question. Then you will feel how it's the to be done, right? Because of this sharing my experience, and this is these are the things that we do, and we are doing the conducting courses for that under my guidance, where it's being the very carefully select the topics according to align with the exam paper, and there are so many people attending with that. And in case if you like, you can, or otherwise all right, if you have a very good trainer, then okay. So this is the first attempt success that they have given testimonials for our things appreciating. And the other thing is we have a learning platform as well for you all to get the a lot of the experience to the no lot of questions focus for the topics, right? Common topics that I am aware as experience of my training. So I have made those the questions for you all to practice, because most of the time I know most of the doctors are practicing not according to the primary care the focus, because you all are going to the secondary care focus by the mm, the following then that some the learning platforms like the past medicine and all, which is the being tailor-made for the secondary care and the tertiary care exams. So that may be another reason for you all to know the getting down from the exam. So thinking that in the gap that the we being family medicine forum, we have the prepared learning platform for you all to go through and the practice your exam topics under the common the blueprinting topics, right? So because of that you can get to know about that from Dr. Shane. He also acting consultant in family medicine, and the Mrcgp holder. So you can contact him to get if you have an interest only, right? To go to it and see the 2 days free trials will be given for that. And the not again study the blueprint, not just the subject. So can you show the
Madam, you want to do the model questions or show the website?
model questions? Yeah.
Model questions.
Yes.
Okay.
And just go through that as well. Guidelines for the preparing for the exam. It's a core reading list in the couple by the domain. That is now the clinically BNF Oxford textbook of medicine, practical the general practice guideline for the effective clinical management. And these are the reading material, Oxford Handbook of the General Practice, not more than this is the one. And the dermatology is very important, ABC of dermatology. And other things more than that, you have to go for the general practice, Oxford Handbook of General Practice, right? And the consultation and communication skills, there are so many, but to the clinical examination, Macleod clinical examination is the one. And there are so many this is mostly important in OSCE and evidence-based practice. So always out of this, you better go to the, I recommend for you to go for the guideline, nice guideline and the clinical knowledge summaries to read. What is this, chain? Yeah, better go for that.
Model questions. Okay.
Yeah.
Yeah, madam, you have the control.
Right, okay. Right, we have just selected for you all to know the go through and to answer. Kindly please answer, right? Okay, because this is just the exercise for you all. And send the answer to chat box. A 32-year-old woman attends her 6 weeks postnatal check. She is fully breastfeeding, has no VTE risk factors, and the wants a highly effective contraceptive method that needs no remembering and won't affect milk supply. So most appropriate contraceptive method. Here you have to read about that. The most important stems, right? The things in the stem. She's 32 year and 6 weeks postnatal, the check. And she's fully breastfeeding, no VTE, risk factors, and the highly effective method that needs no remembering. So, and the won't affect milk is the one, and more than that, after the underlying these things, you can go to the most appropriate contraceptive method. That is the important thing. So, having that, the select that combine OCP and the progesterone only pill. So, because these things I told you, only the 2-3 types the questions are the one you have to, because most remembering it can't. This A and B is out, and levonorgestrel IUCD, and as well as the male condoms, and the lactational amenorrhea method, the continued indefinitely. So what are the two answers should be? Because in 6 weeks, so let me know. So you have to select now C and and as well as the E. Out of C and E, what is the best thing? Because lactational amenorrhea method that is, the continued indefinitely, and this levonorgestrel intrauterine system are the two questions that you had to select. Yeah, very good. The one has sent the answer saying C, because this one, LAM method, in the sense, the lactational amenorrhea method, if the exclusive breastfeeding, at the time of that it's protective, but it's latter part of this breastfeeding, it is not in the becoming that much reliable method. So levonorgestrel intrauterine system is the one, the correct answer. So we'll go to the answers. Best answer is that one, and the levonorgestrel is the 1 to 4 weeks. The postpartum, that is the UK medical emergency criteria, that is MEC, right? In pregnancy and in breastfeeding, they say that is not necessary. That is, they say the 4 weeks postpartum while breastfeeding, more than 99% is effective, fully reversible, and no daily action and no effect on lactation as well. So that is why it's the best answer. But to the combined oral contraceptives and the POP is out, because I told you male condom, that is user dependent. So she has no control about that, and as well as higher typical, the use failure rate is there. And the lactational amenorrhea method only reliable while exclusive breastfeeding, and the amenorrhea and the infant less than 6 months, but with time it is going on. So she has not mentioned the duration that she wants. So because of that, you can't depend on that latter part of, if the baby is being introduced the food, and it's not the exclusive breastfeeding, it fails. So that is the answer, right? That's how you have to select it. And the 27-year-old woman with PCOS, right, BMI 34, has an ovulatory subfertility for 14 months. You see that, the BMI is very important. It's very high. And ovulatory subfertility for 14 months, and the semen analysis and tubal patency are normal. Right? She wants the pharmacological ovulation induction. So that's what she comes and answering. So we also know now she needs something like that. Once such a patient comes, you must think of giving her such a this thing, and you have to send her to the gynecologist to select the best, the ovulatory inductive method. So it's the most appropriate first line agent out of all, you have to select it, right? Clomiphene citrate, the letrozole, and metformin monotherapy, gonadotropin injection, and as well as, the other one is oral contraceptive pill. So can you give me the answer, please? Yeah, that is what we were talking to you. That is, the two people answered out of, the 32. So anyway, so you have to try, because whenever you make the mistakes only, you will, motivate for the reading and to the getting improved. So because of that, please do that. This is the very good question that the one person is saying that B, another one is B is letrozole, A is clomiphene citrate, C is metformin monotherapy. And A, B, C, the three questions have, the answers have been selected. So that is why I told you, always you have to read about the stem of the question, and no, that's not the stem. What is the focus, that she wants the pharmacological, she wants the pharmacological, the ovulation induction and most appropriate first line agent. So that is the important thing, that you have to reread it whenever you have the answer of the question. But the metformin is anyway out. right? That is not the pharmacological the treatment to induce, that is for the weight reduction and insulin resistance reduction. But here, because she's obese, it's correct for that. But here, it should be A in between A and B. The two answers must be, I told you. But, I told that it should be the guideline based always. The guideline says the clomiphene citrate is the older version. Now they say more than the clomiphene, the letrozole is the first line, the treatment that you have to think about. So that they are going to check your knowledge about the recent the guideline update. So that's how this question has been made. So that is why the one answered as A, clomiphene citrate, but the other one who has, who have, the read this question, the guidelines, the carefully with the new updates, or she may be working in a gynecology unit, I don't know, but letrozole is the answer, right? We'll go to the explanation there, right? Letrozole, that is aromatase inhibitor, is first line for ovulation induction in PCOS with higher live births and ovulation rates than clomiphene. You see, that is the real answer, because clomiphene is the undervalue comparing to the letrozole. So answer, because so they are asking according to the stem of that question, you have to know the select that. Know that the question most appropriate first line agent. So that's why it should be the letrozole and the updated guideline answer. Metformin therapy, not first line alone, and metabolic adjuncts only, that is weight reduction, inferior for ovulation and the pregnancy. Gonadotropin injection, it's a second line, right? Used after oral agents fails. So needs, the specialist monitoring as well. That is another disadvantage. Once you give that gonadotropin, she needs, under the supervision of, the gynecologist. So that's why it is being second line, right? Not the, but letrozole, once you recommend, so the patient, it's not that frequent monitoring is being the needed. And the combined oral contraceptive pill is, the suppresses ovulation. So it's in the contrary to the goal of the conception. Now you understand how you must do that. The woman of at 36 weeks with pruritus of the palms and soles, right? That is a pregnancy and itching is very important topic that you must read. They are very much fond of that topic, right? So because of that, the exam board and pregnancy and safety is very much important for you all, and to early diagnosis and early management of such diseases also they are expecting from you. So that is why this question is being set to you, and this is one of the common questions they ask. 36 weeks pregnancy and with pruritus of the palms and soles, not even though the other body areas itches, you must exclude, always ask from the patient whether the palms and soles are being itchy. That is very, very crucial, right? So, and the worst at night, no rash, and the peak bile acids 45, right? And mildly elevated transaminases. Other cause found, no other causes found, fetal monitoring reassurance, right? That no problem in the fetal, the movements, that is normal, but no other causes found is always you have to underline. Now go to the question. So you can go to the liver enzyme report of that particular patient as well, right? They are ALT is, the elevated, AST mildly elevated, right? And both are not that high amount of, but compared to that, alkaline phosphatase has been elevated. Other than that, all others are the normal, right? So important thing is elevation of alkaline phosphatase with minimum elevation of ALT and the AST. So now you know, so most appropriate first line pharmacological treatment. So you must know these things, because once you get such a patient, you have to do, that's your knowledge, is to do the liver function test. That is because you need to exclude the liver damage. The pregnancy, there is higher risk of getting liver damage with so many, it's called the HELP syndrome. And, even sometimes the infections, because pregnancy is, the immunosuppressed situation where you can get some infection, and the fulminant liver failure, it's easily the patient can go ahead. So that's why you have to be very much careful about the liver, the health status. So here, so once you, then being the primary care physician, the exam panel expect from you that to do this test and the interpretation on that, and your knowledge why we should send this patient, what is the next management that we have to do. It should be under the, anyway, if you know the proper guidelines, so you can start, or otherwise, so you have to send the patient for the best the opinion from the gynecologist. So you know why we should send that patient as well, right? That is most appropriate first line pharmacological treatment. It is, again, you have to be very clear about the stem of the answer. That is UDCA, that is deoxycholic acid, and cholestyramine, and rifampicin, oral antihistamine alone, topical emollient alone. So what should be the answer? Just give the guess. That's very good because you know the answer. That is your UDCA is the answer that you can, even the start and close monitoring is necessary, blood pressure and liver function test monitoring, because in case of the patient symptoms are getting more and more, then you have to send the patient. But anyway, you must know what should be going to give, right? That is very important thing. And we'll go to the answers. Explanation. UDCA is the most recommended first line treatment for the ICP, that is, that is called hepatitis, what is that called? Obstetric cholestasis. That is the patient intra ICP. ICP stands for Veta. Intracolic, the hepatitis, no? Hepatostasis, the Shane, but exactly I can't remember that is.
Sorry, madam.
ICP stand for
First line treatment for intrahepatic, sorry, ICP.
cholestasis, intrahepatic cholestasis, right? Correct.
ICP.
Yeah,
Let me check that.
no, it's okay. Intrahepatic cholestasis, right? Intrahepatic cholestasis in pregnancy. Now I remembered. So this is, the recommended first line treatment for ICP, improving the pruritus and the liver function derangement. That is why we are giving that. Liver function derangement is there. So we need to check whether patient is coming back to normal with strongest evidence-based, the management is that. So why this cholestyramine impairs fat soluble vitamin, vitamin absorption and less effective than UDCA, right? So that is not being given now. And the rifampicin, the adjunct in refractory cases only, but it is the treatment option, but it is not the first line. And the other thing is oral antihistamine alone. This is another question, loan, right? It's a loan in the case that you have to close your eyes and that you can disqualify that. Symptomatic only, that is does not treat the underlying cholestasis or liver function test improvement. Topical emollient alone in the mild, the comfort only. No evidence for the cholestatic, the pruritus, just the dehydration and the dry skin, it will be helpful, right? So this is very important. The part of the Mrcgp International exam in AKT, they are very much concerned about the pregnancy and the liver safety. And the pulmonary embolism, this is 52-year-old man, has the pleuritic chest pain. That is very important, age of the patient and the acute pleuritic chest pain that you have to underline, and breathlessness 3 weeks after the long haul flight. Hemodynamically stable, right? And the patient heart rate is 98, oxygen saturation is 95 normal, 2 level or close to normal. It's low, but it's not that the urgent. 2 level well score. It's the says that pulmonary embolism is likely. So most appropriate immediate next step in primary care. What they are asking, because patient comes to us before going to somewhere else, because in other countries GP system is the first contact place that they allow, not to go to the secondary. In case of if the patient is severely breathless, so they can straight away go. Other than that, the first place is that. So most appropriate immediate next step in primary care. So that is the important thing at the primary care. The routine outpatient D-dimer review in 48 hours. A. Emergency same-day hospital assessment for CT pulmonary angiogram plus or minus interim anticoagulation, and start oral anticoagulation, arrange routine referral. Option C. Option D is the reassure safety net review in 1 week. And the option or the E is community. That is at your clinic you can do the chest X-ray review, deciding on referral. So what is the answer? Please the mute, the Sandaruan Bandara. Dr. Sandaruan, please mute. Can you all let me know? What is the answer? Yeah. So you have answered the correct thing. Very good. That is the emergency same-day hospital assessment for CTPA plus or minus interim anticoagulation. So why the routine outpatient D-dimer and the review in 48 hours is wrong? Because it's emergency. So we'll go to the correct answers. And in between, either the question should be here the B or C, start oral anticoagulation, arrange routine referral. But it's a routine referral is wrong. This is emergency. But we have mentioned about this is the pulmonary embolism for you all to get an idea as the beginners. But in exam, it is not coming like this. They will give you the question stem like this. And you have to identify what this is. And they will minimize the clues, right? So because of that, it's very important for you to know about the guideline management. So we'll go to the explanation. This is the best answer, emergency same-day hospital assessment for CTPA, coronary pulmonary angiogram. And the pulmonary embolism is likely on Wales score. That is, Wales score is the one you must know how to calculate at primary care. That is very important thing. So being primary care physician, you must know the Wales score. So go and read about the Wales score, right? That is very, very important thing. And here why the other options are incorrect. Here the reflecting the risk of the untreated pulmonary embolism and need for urgent diagnosis to start the treatment. So the A option is routine outpatient D-dimer review in 48 hours is wrong, because D-dimer only used when the pulmonary embolism is unlikely and should not give decision here, right? So that is not the way that you have to do. And the start oral, the anticoagulation, and the arrange the routine referral. Its anticoagulation may breach according to the you can start, but the referral must be the emergency, not routine. And if you don't ask about if you don't, concentrate on the referral, it's the not routine referral, it should be the correct way that your answer will go to the B. Otherwise, you might mark as here and the routine referral, right? And reassure safety net, because this one part is correct. Anticoagulation, start oral anticoagulation and arrange referral in that case if you think that it's the emergency referral should be, right? That is the thing, or admission. Reassure safety net and review in 1 week, very wrong, unsafe. And the chest x-ray and as well as the review before deciding on referral. The chest x-ray may be normal, right? In most of the cases. So does not exclude the pulmonary embolism. So chest x-ray has no place here, right? So because of that, it's wrong. So just to mention you about the Wells score for the the pulmonary embolism, it's on the clinical features that they are going to give the 3+ and 1+ marks. So you have to know if it is more than the 4, its pulmonary embolism is likely. Less than or equal 4, its pulmonary embolism is unlikely. So the 3 level, they are going to check it 0 to 1, low probability, 2 to 6 and moderate probability, and more than 6, the high probability. So because of that, you must know how to calculate the Wells score just to get an idea. That is the clinical signs of DVT like leg swelling, pain on palpation of the deep vein is there +3. Pulmonary embolism is the most likely diagnosis on your clinical picture. They give you the +3. Heart rate more than 100, it's again 1.5+, because there may be some other reason as well. The marks is +1.5. And immobilization more than 3 days or the surgery in previous 4 weeks, like the long haul flight is here. The more than 3 days it should be, or the surgery in the previous 4 weeks time. So +1.5. And the previous DVT or pulmonary embolism, they will give you again the +1.5 marks. Hemoptysis is their association with this time, it's a +1. And the malignancy, that is on treatment, treated within 6 months or palliative, the patient is on another palliative treatment, or the non-patient with malignancy +1. That's how they are going to give the score. I just mentioned about that for you to go and read about that as well, right? So now we'll move to the next question. Here, the 54 years, the old man has several months of the bilateral gritty, but we have given diagnosis just to support you, but don't expect to have this diagnosis, right, in the exam. Several months of bilateral gritty burning eyes was in the morning, mild lash crusting as well, lid lag erythema, and as well as, with that is collateral that is correlates, and at the lash base, that is being together, the visual acuity normal, cornea clear, no phobia or significant conjunctival injection. Those are the important things that you have to underline. Most likely diagnosis, they will give you the pictures, right? So very nice pictures they will give, so that you can, have to identify the diagnosis. So here, most likely diagnosis. So blepharitis is not there in the top, but you have to identify that it's blepharitis, bacterial conjunctivitis, acute angle closure glaucoma, herpes zoster ophthalmicus, and orbital cellulitis. So if you take that, out of this is very much obvious question. That is already we have given the answer, so no point of the discussing about that. You can see it's, when you go here, it's the redness around this eyelid margin, and the no eye, the lashes mostly, and sometimes it's being the sticky eyelashes are there, and the patient says it's very much the gritty feeling, and burning eyes as well due to the inflammation. So that is answer is, the not the anything else. Herpes zoster ophthalmicus, the should be exclude because herpes zoster ophthalmicus also can come in with like this, but the there are the lesions, the more virulent or even one or two the blisters should be there. It's not that so. Bacterial conjunctivitis more acute, and this is the chronic for a few months the patient has with purulent discharge and conjunctival injection is there. Acute angle closure glaucoma, again painful red eye, halos, but the vision is being affected. On examination, fixed to the mild dilated pupil. This is emergency to send to the eye surgeon. And herpes zoster ophthalmicus unilateral resolves with the V1 with the rash and vesicular rash, unilateral vesicular rash, and acute onset with blisters. And oral orbital cellulitis, acute, usually unilateral. The slightly in the life, the threatening, like the redness is being associated. Marked swelling with proptosis is there. Shane,
Yeah.
what has happened?
Yeah, just give me a second.
This is regarding, the management of the blepharitis. Best, oh no, go back, ne? Right, okay. This is the same 54-year-old man is confirmed to have the chronic blepharitis with meibomian gland dysfunction, no red flag features, and the um, normal in the visual acuity. He asked how to manage his symptoms. Most appropriate first line management you have to identify. Twice daily eyelid hygiene, warm compresses, the massage, and the lid margin cleaning. Immediate urgent same day ophthalmology referral. The topic, the topical chloramphenicol alone, no eyelid hygiene. Oral high dose systemic corticosteroids, reassurance only, no active treatment. So, what is the answer? This is the easy question. So, the twice daily, the number A, yeah, you are very correct. Twice daily eyelid hygiene, and no need to go ahead with the other ones as well. This is the easy questions they will give you once in a way, right? Then this is again 45-year-old man with plaque psoriasis on topical therapy alone. The smokes, the 10 cigarettes per day, BMI 31, no known diabetes, hypertension, no CVD. So this is the picture. They will give you the picture. They will not give you this is psoriasis, right? Keep that in mind. They will give you the clear pictures like this. Here, the patient is having chronic, the plaques with silvery scales. Here you can see, right? And when it's a pictures is very much the more obvious than this, right? They will give you the clear pictures, and the pictures are very common thing that they will give you for you to identify and come to the diagnosis. And here, so most appropriate, the additional management step, right? This diagnosis, the disease and the treatment is very much obvious. Here you go, additional the management step, or the important the management step more than management of his skin rash is the question. So no CV assessment needed. Psoriasis is skin limited. Formal cardiovascular risk assessment and repeat periodically. Start statin the routinely regardless of risk score. Refer for bariatric surgery as a first line of the cardiovascular risk reduction. Avoid methotrexate in all patients with psoriasis and obesity. So what is the best answer? They will give you the questions like this to check your knowledge in safe management of the patient, right? Can you all give the answer? Yeah, it's very good. Excellent. That is there. You have marked the answer as B. That is formal CVD risk assessment need to be done for each and every patient with the chronic plaque psoriasis. That is the underlying, like in the gout, the chronic gout also same. And, the here also same. The more than the treatment of the plaque psoriasis, being the primary care physician, you have to assess how risky for him for the future CVD events, for their family history and as well as doing lipid profile, past history of CVD events and lipid profile and as well as the renal function and the assessment with the ECG and the 2D echo is a must for this patient to identify the calculate the Q risk and in order to manage him not to get the CVD event in future. That is very important thing. So start statin routinely regardless of risk. Oh no, that is wrong. And refer for the bariatric surgery. That is depending on the bariatric surgeries for the BMI 40 and above, right? It's not for that. And the refer for the avoid methotrexate in all patients. That is with psoriasis. That is wrong because only psoriatic arthritis patients are being given the methotrexate, or if it is severe resistant forms, only being treated with methotrexate or other, the immunomodulator therapy. This is best answer. Recommends formal CV risk assessment and at diagnosis and periodically, since moderate severe psoriasis is an independent CV cardiovascular risk factor, right? So my other options are incorrect. Psoriasis is skin limited. Psoriasis is an independent cardiovascular risk factor via systemic inflammation, which happens in this disease. Right. And the other thing is start statin. No, you have to calculate the risk of, the CVD risk only. Then you are going to give it and refer for the bariatric surgery. It's not the lifestyle measures for this BMI, not the initial step. Avoid methotrexate, not, the contraindicated by obesity. The remain a standard systemic option for the severe resistant diseases. The next question is 38-year-old woman with psoriasis has 6 weeks of small joint, hand and lower back pain, stiffness, morning stiffness more than 30 minutes, and the one diffuse, the diffusely swollen sausage toe. So the most appropriate next step in the management. The reassure joint symptoms unrelated unless skin disease is severe, and the use validated screening tool and refer to the rheumatology and start oral NSAIDs alone, no further assessment. The rheumatoid factor only, reassure if negative, only refer if the skin disease is more than 10% of the body surface area. So what is the answer? Yeah, good. So you have given answer as, the B. Right, that is, the validated, the screening tool using that you have to refer. Anyway, in our country, we are not using very much the validated, so the screening tools like PEST, but anyway, that is the guideline-based management. That is dactylitis, that is the sausage, the digits in either hand, so, the feet, and, the more than 30 minutes inflammatory stiffness, and the axial or peripheral joint involvement are classic psoriatic arthritis features. You must know about that, right? So that is the answer. And why the other options are incorrect? Reassure it's not that, because it's a systemic, the symptoms are there. And start oral NSAIDs and no further assessment. No, that is symptomatic relief, but the need to know the have to stop the joint the damage by the starting methotrexate or the other immunomodulator therapy, which is the vastly it's being used by other countries, not the methotrexate even. And the rheumatoid factor only, no, sorry, it's very wrong. That is, negative rheumatoid factor does not exclude it. Even rheumatoid arthritis is, the uh, uh, always can't expect rheumatoid factor to be high. It is the less sensitive, the indicator. Their anti-CCP is the one for the rheumatoid arthritis, but here the PSA is typically seronegative. So never expect the seropositive, the test to be done. The only refer if the skin disease is more than 10, though that is referral is based on the joint features, not extent of the skin disease. And there are one or two other questions remaining. This is investigation. Again, they will not mention about this stable angina investigation and all. So they will not, you have to diagnose it, and then you have to come to the correct answer by going carefully through the question, right? 58 years old man has 4 months of exertional central chest, the tightness relieved by rest. Oh, that is a very important 4-month exertional central chest tightness relieved by rest. And the background hypertension and the hyperlipidemia is there. Currently pain-free, resting 12 ECG, the today is unremarkable, right? And so most appropriate next step in management. Reassure no further investigation needed as the ECG is unremarkable. Refer for CT coronary angiogram as the first line. But imagine that if provided that this stable angina investigation should not be there, then you have to go think about this question and coming. Now we have the simplify that by giving topics, but it is not coming at the time of the case, the question practices even with us or with someone else. So you have to think, right? Arrange, you have to come to the diagnosis going through this, and it should be matched to the case scenario, right? The question scenario, STEM. Then arrange exercise tolerance test as the first line, and commence regular oral opioid analgesia, emergency admission for the primary PCI. So what should be the answer? It's very clear now. I told you that is someone has answers to C. That is wrong, because I told you the universe guideline. That is the updated guideline says, not the exercise tolerance test. That is the important thing that you have to know, right? The refer for the CT coronary angiography as the first line investigation. That's the importance of being updated with the updated guideline management. So we have, in our the learning platform, we have given the questions and the answers, and as well as there are more than 2,000 questions that you can practice on the common topics that exam is focused for, and as well as, uh, hold on, as well as, it's, it's you must be updated for the guideline reading, and we have uploaded the nice the guideline management as well. We have uploaded the nice guideline summaries for you to read into the learning platform. Give me one. Sorry about that. This is you must send the patient for the CT coronary angiogram, and not only that, you have to give the patient the aspirin 75 milligram, and in the pulse rate is little bit higher than normal, you can give the beta blockers as well. So this is the cardiologist referral in order to get the CT coronary angiogram done. Right. So Shane, can you show our learning platform to them?
Okay, madam. I'll stop the presentation.
Yes. So we just give you the insight about how to how to start and how to get the training, and to get ready for the first attempt success, because your goals are high and exam is tough with the guideline based the always. So you must know to find out how to get it the approach that the difficult the task. So that's why the Shane will show you that what is the learning platform that we have, and kindly please the Shane show them the questions that the model questions that we have, the clear questions, right, and the guideline summaries as well, Shane. So
this is our website also. So this is how we give access to the learning platform. So just to show you a little bit about the website. And these are some of the testimonies of our students. And these are the course programs. So if you wish to get training for the Mrcgp Part 1, Mrcgp Part 1. So we offer the Mrcgp package, AKT package. So you can register through this link, or the Mrcgp International AKT course. Right, so here we are going to the LMS portal. You have to enter your username and the given password, which will be provided for you. So I will show you the questions in our question bank. Yeah, for example, this is one question. Can you see the screen? Yes. A 54-year-old man presents for a routine health check. Clinic blood pressure is 152/94. He has no significant past medical history and feels well. Physical examination, including fundoscopy, is normal. According to NICE guidelines, what is the most appropriate next step to confirm the diagnosis? Would you like to try answering this? C. Yeah, so you can put the answer and then check your knowledge. So yeah, your answer is correct. So, and the explanation is also given for the incorrect answers as well as the correct answers. And the correct answer is of a ambulatory blood pressure monitoring. So likewise, you can see all the questions in the question bank. Cardiology, we have divided according to the modules: cardiology, nephrology, respiratory, women's health, rheumatology, infectious diseases, endocrinology, psychiatry, gastroenterology, dermatology, men's health, so and so on. So you can see the topics. Right. So let me also show you the nice guideline summaries. Yeah, so these are the nice guideline summaries. Those are also divided according to the topics. The given topics. Okay, and let's see if you want to get revision about cardiology. So here we are. So the nice guideline summary is provided in this manner. For example, this is about peripheral arterial disease. So this is like a summarized note about peripheral arterial disease based on the nice guideline summaries. Right, and also there's a summary for easy reading. Yeah, so that is what we can offer you from our Mrcgp fast track course. So thank you very much. Madam, over to you. Dr. Mahakanti, are you there?
Uh, Thank you so much for joining, and I wish you all the very best. And start the question practice with guideline based, the uh, way. That is very important, and hope you will get the success. Thank you very much. Okay, all the very best. Thank you for joining tonight. Thank you, Dr. Chen.
Thank you, madam. Okay. Hello, madam.